First, I would like to ask for your permission to use this video for educational purpose.
Yes.
Now, actually, you are my patient today,
Yes.
but your wife has experience with the spine, and I'm just going to ask you, can you tell me about your experience with your spine surgery? First of all, when was it?
It was August 2010.
So about 7 years ago.
7 years ago.
And you said you got a fusion in what level?
L5S1,
And did they go from the front and back or just from the back?
just from the back.
And just explain and just tell me a little about how was your experience? How long did it go, and what was your experience with that?
Well, the surgery itself took about 14 hours that I was on the table, and I lost a lot of blood. And when I woke up, like, the pain was just so excruciating. I couldn't walk for like 2 days.
What time in the morning did they start the surgery?
At like 6 o'clock in the morning.
And then when did you came out of
It
the
was night. It was like 8, 9
Wow.
o'clock.
Wow.
It was nighttime.
Now, and how long after the surgery did you start walking?
It was about 2 days before I could walk. Like,
How long did you stay in the hospital?
I was there about a week. I think
Okay.
5 days, I think.
When you went home, how were you? How was the pain? And
It was horrible. I couldn't walk unassisted. Nothing. Like, I had to be carried to the bathroom, stuff like that. Like, I
Okay.
could not.
how long did it take you to go back to your basic daily activity?
I actually had another surgery in October because I still couldn't walk by then. So I had another surgery where they replaced screws and rods. And then it was probably about 3 to 4 months after that that I could actually
Okay,
walk, but I still used a cane or a walker
Sure.
for the first year.
sure. Now, just to be realistic, your experience was on a little on the extreme of what open surgery is, but not that unusual. In the open surgery, that can easily take somewhere between 6, 7, 8, 9 hours, and blood loss can easily be about a liter, about a pint or even more. And your experience otherwise, very typical for open surgery, because in open surgery, we fillet you open. We cut lots of bone just to get there, and when we get there, there are lots of blood supply around the nerves that they can truly bleed. Now, I'm just going to tell you what are our average time in the last 5 years for OLIF procedure. Our average time for a one-level OLIF has been 35 to 40 minutes. For two-level has been about 1 to 1 hour and 5 minutes. Our average time, please, could you let us record this? Our average time for the two-level blood loss has been about 50 cc. For one level, around 40 cc. And many patients with the one-level fusion, actually, they go home right after the surgery, about 2-3 hours after the surgery. For a two-level, many patients as well go home, but sometimes we keep them over the night, just observe them. But generally, most of patients are ready to go home after a night or so, and they're back to their basic previous life within 2 to 4 weeks. Now, it's any surgery going to be painful, and no surgery comes with guarantee, but this is our average result based on about 500 cases. So, and you practically summarized what's the advantage of a open versus minimal invasive surgery.
Well, the recovery time is a lot less.
Yes.
Scar tissue, I have a lot of problem with the scar tissue that it caused from having such big incision and such an invasive surgery.
Actually, I
And
just
now I have a huge scar.
and it's more important about the size of the scar in the skin is actually the scarring that happens under the skin, because in a regular surgery, in open surgery, we devascularize the muscle, we cut the bone. Those muscles, they all die, and actually they scar in. And I just put a picture on Facebook that you see that what's the difference between if you cut the muscle and if you don't cut the muscle. After you do open surgery, those muscles are not functional anymore. Whereas after our surgery, we save the muscle. Those muscles are really alive and help the recovery process. So that's the important is what happens under the skin and not at the skin level. But those scarring and all the damage that happens to the tissue is what makes the open surgery open and minimal invasive surgery minimal invasive. Well, thank you for the interview and sharing your experience.
Thank you.